Now, looking at the possible laboratory test findings for acute kidney injury, that's like if I send the samples of a patient that from the history taken and the physical examination, and suspecting that this patient actually has what? An acute kidney injury. If I send the samples to the lab, what are the results I'm actually expecting to get? As a medical professional, you're actually supposed to know everything. Okay, even something that I send into the lab, you're supposed to already know what will be coming back. So for acute kidney injury, the result might look likely like this. So you see that what? The serum creatinine, that's what the SCR, so is normally between 0.6 to 1.2. Do you understand? So it will be elevated. Elevated could be any figure. Once it is more than this range, it's elevated. Okay. Blood urea nitrogen is usually between 8 to 25 milligrams per dl. So anything more than this, it shows that what? There's acute kidney injury. Do you understand? So it will likely be more than this 8 to 25 milligrams per dl. All right. Then creatinine clearance, that's the amount of creatinine that the kidneys is actually clearing per minute. Normal should be about 90 to 120 mils per minute, but you find it to be decreased. That's what is making the serum creatinine to increase. All right. The blood urea nitrogen creatinine ratio will be greater than 20.1. Okay, in prerenal, it will be less than what? 20 by 1. Sorry, it's by 1 in intrinsic or postrenal. There you see that potassium levels will be raising up in that person, and normally acid levels, because the kidney is supposed to be clearing out acid, but because the kidneys are not working well, there's like a backlog of acid in the body. So that's what's actually causing metabolic acidosis. Right. So that's just it for the possible laboratory test. Right. If you send it for acute kidney injury, that's the possible things that you're actually supposed to actually see. All right, for a patient that has acute kidney injuries. Okay. So that's just it for this.